requested and appointed to be the moderator for this important meeting, and Mrs. Jackie Katana is going to be the co-moderator. And so on behalf of the moderators and on behalf of the Faith for Family Health Initiative, I take the honor to welcome you all to this high-level meeting for the dissemination and learning on the family planning, budget advocacy, and accountability. And so you're welcome, and the meeting is going to be both physical and virtual. And because of that nature of the meeting, the moderators will moderate the meeting while seated, because we will want to make sure that we monitor both who are on the ground attending the meeting physically, but also to monitor those who will be attending virtually. And so the program begins with opening prayer. Request Father Deus to come and open our meeting with prayer. And then after the prayer, we will go ahead and have introductions. And my co-moderator, Mrs. Jackie Katana, is going to guide us in that section of self-introduction. So, Father Deus, would you please come and open our meeting with prayer?
Our Father, who art in heaven,
hallowed be your name, your kingdom come, your will be done on earth as it is in heaven. Give us this day our daily bread. Forgive us our sins, as we forgive those who trespass against us. Lead us not into temptation, but deliver us from evil.
Amen. God our Father, you are so merciful. You created us in your own image. You love us so much that you have gathered us together here. You have made us go through several journeys from different homes, from different places. We thank you for that. And we entrust to you this wonderful activity that we are going to carry out. May all the discussions be for the greater glory of your name and for the development of humanity. We make this prayer through Christ our Lord.
Amen.
May the blessing of the Almighty God come down upon you and remain with you now and forever. In the name of the Father, and the Son, and of the Holy Spirit.
Amen. Amen. Thank you. Thank you very much, Father Deus, for that opening prayer. I will now go ahead and request my co-moderator, Mrs. Jackie Katana, to go ahead and introduce people who are attending this meeting. And I request, in order to save time, to introduce them in their categories so that we save time. After her, we'll go ahead and watch some videos or relevant videos on advocacy, or in other words, the ones which are relevant to our meeting. Jackie? Is this working? Yeah, it's working.
Thank you very much. Thank you very much, my Lord Bishop, our co-moderator today, and we welcome everyone to this very important meeting. Most of the people are speakers today, and we'll hear from them by names and what they do, but I'll introduce in categories. As you said, we have our leader from Ministry of Health, Director Curative Services, Dr. Aro, you're welcome. We have our members of parliament. I saw a few. I don't know whether they've gone for lunch, but there's Honorable Rachimari, who is a board member. Sometimes we forget you in that capacity. So Honorable Rachimari, you're welcome. We have our other government representatives. We have the Director of Family Health from National Population Council, Dr. Betty. We have our district leadership from Mitiana and Chenjojo. So we have Dr. Rasampija, DHO Mitiana. And we have the Assistant LC5, Honorable Bagaba from Chenjojo district. Then we have our, we call them district interfaith committees, people who have implemented this work. They are normally 5 to 6, but we selected 3 and 1 from Toroko. Kindly all of you stand. The district interfaith committees who have represented the rest. The members are here. And sister, you're behind the cameras. I don't know what we are going to do about that. And already gender is an issue here. Yes. We have our media that we've worked the journey with, Addis, and the colleagues are coming. We also have our CSOs that have walked the journey with us, but also are experts and implementers in regard to this model. Apparently, we have Director Samasha, Dr. Muonge in the room. We have our other staff from members of parliament. They've become family. We have Lillian and Prosi. They're already here. And then we have our board members. Board members of 3FHI, could you kindly stand? Including the rest are coming. Father Mbona Linja, Deputy Mufti, but the Archbishop, given his current chair, is still very busy, but he sends you greetings. We have our other senior religious leaders, the Bishop from Mitiana Diocese. He joined just recently when we are implementing, but has become an expert in this model. That's good. So we are really, really grateful. And then we have 3FHI staff. In the room we have 2, but also we have others that are global and they'll be joining online. I think with that, we'll be joined by quite a number of people online. The ones that have confirmed, we have our donors, and those are the people who have made this model happen, starting from Population Action International, FP 2020, and the current one on Accountability New Venture Fund. They'll also be joining, and many others who are implementing and supporting this model. Thank you very much.
Thank you. Thank you very much, Jackie, for that good introduction. Of course, we'll continue to get to know people as they continue to be introduced, especially during the time of the panel discussions. Now, the ground rules, our time is budgeted for each and every item on the agenda, and so we request that we keep time. When you are given an opportunity to speak, please make sure you use the limited time that is given to you so that we are able to finish in time. Also, since we have also been informed that the meeting is both physical and virtual, we have to be aware that those who will be online will make sure that we keep time so that they know that the time which has been budgeted for has been observed. Now, we will, again, as I said, we will sit down and moderate the meeting from down. We will be doing that in order to monitor those who will be like giving comments electronically, raising hands electronically, or wanting to say something, so that we are able to monitor and make sure that we get to know that there are people out there who are participating in our meeting. For now, I request that The technical team helps us to watch the relevant videos talking about the stories that are relevant to advocacy.
We, the Faith for Family Health Initiative, hold the view that if faith leaders are mobilized, capacitated and engaged, their voices and actions documented and amplified, then they can become a catalyst for behavior change, effective agency for healthcare delivery, and indispensable actors for health policy influencing, thus contributing to better family health and well-being. Focusing on 8 districts: Metiana, Mubende, Chenjojo, Iganga, Kagadi, Namayingo, Kabarole and Busia. A number of achievements have been made. Allocations to family planning stand at 864 million Uganda shillings. District Costed Implementation Plan 6 have been launched, 1 approved and 1 drafted. Health executive and civil society engagements have increased and been strengthened at district level. Increased interfaith-led family planning advocacy. Increased political and decision-makers' engagements. However, a challenge remains as studies show that the modern contraceptive prevalence rate is 36 against the government's target of 50% by 2020. This is as a result of poor budget allocation for family planning at national and district level.
We want to see a God-fearing nation. We want to see a healthy nation. This was our resolution, all religious leaders.
We pray that the decision makers help to continue to support, to influence policies, the leaders in this country, and also have engagement with them in order to keep trend of issues running the same way.
Most districts anyway, because I've been interacting with a lot of people, they have not taken family planning serious, and the amount of money dedicated to that area is little or not there. So it is high time the gender ministry to look into that, and those responsible for the budget of Uganda and for the districts to look into that, because that is an area which is going to help us.
During the 3rd National Family Planning Conference, interfaith religious leaders, decision makers, development partners and government officials highlighted the need and importance to invest in family planning.
Uganda will only attain Vision 2040 objectives by ensuring implementation of Family Planning 2020 and beyond commitments, allocating more domestic resources to family planning in order to harness demographic dividend.
That Makanga moves from here when he has promised us that he's going to tell all the districts to make DCIPs as an instruction.
We are still advocating for a specific budget line for family planning. We also want to advocate for a budget line for family planning at district level. So this is excellent, and I'm sure those that are responsible are listening.
Tragically, an increase in population will slow development, and economic growth averaged 1.38% between 2008 and 2019. In order to reverse these trends, the interfaith religious leaders, through the Interfaith Alliance on Family Planning, make an urgent appeal to the national government, the elected leaders, and the district council to allocate more resources to family planning. Specifically, allocate 5% of the national budget to enhance full realization of the Family Planning 2020 commitments and full implementation of the NCIP-FP. Develop a framework to guide the district council to allocate at least 3% of their revenue to finance their respective DCIP. At the 3rd National Family Planning Conference, inter-religious leaders made commitments. We commit to continue providing support to quality family planning education, service delivery, and referrals to all communities. We commit to continue advocating for increased investment in family planning and health sector according to Family Planning 2020 commitments and Abuja Declaration. We will continue to advocate for tracking and spending on family planning commodities, in-service training, and facility improvement based on budget allocations. We commit to advocate, sensitize, mobilize and partner with the government, traditional culture and all other stakeholders to enact policies that address lack of access to services due to distances, cost, lack of trained personnel and insecurity. We commit to advocate for religious leaders to address the unique issues that affect youth in family planning and ensure end of teenage pregnancy. In order to implement these commitments, an Interfaith Alliance on Family Planning was formed and launched to advance family planning investment advocacy at national level. In order to address the unmet need for family planning, the district governments of Mityana and Kyenjojo in Uganda developed the District Costed Implementation Plan for Family Planning. In 3 years, the two districts allocated $94,231 to family planning. Despite the investment made, family planning indicators have remained poor in the two districts. Accountability processes have resulted to low allocation, untimely disbursement, and poor absorption of the public funds for family planning. However, accountability of family planning funds at all stages is essential, ensuring that the rural population of Kyenjojo and Mityana access high-quality family planning information, services, and commodities, thus improving their quality of life. Budget analysis for Mityana and Kyenjojo shows interesting trends and patterns regarding allocation, disbursement, expenditure, and absorption of family planning funds.
The district depends on donors, the activities will not be done.
It was utilization of CIP in informing district family planning budget.
Disbursement of health budget from the central government to the district is not timely. The disbursement is never 100%.
When funds are not used, automatically the communities will not be transformed.
We, faith and religious leaders, note that the district has no dedicated budget line for family planning. There are delayed and reduced disbursements of funds for health and family planning to health facilities. The District Costed Implementation Plan is not informing planning and budgeting for family planning in the district. There is low absorption of health or family planning funds at facility level. There is over-dependence on donors for family planning funds. We faith and religious leaders recommend
We are allocating a certain amount of money, for example, maybe it could be 10 million for family planning and is specifically for family planning.
They are not aware of the DCIP, so they are not using it for planning. We recommend that the district support engagement, to engage with the central government to ensure prompt, timely and full disbursement of the health budget.
It means we must encourage the district to generate revenues.
The district should have a dedicated budget line for family planning. The district should ensure prompt, timely and full disbursement of the family planning funds to the healthy facilities.
health facilities to develop robust mechanisms for monitoring, utilization and accountability for health family planning funds. The district to ensure prompt, timely and full disbursements of health or family planning funds to health facilities. In order to address the unmet need for family planning, the district governments of Mityana and Kyenjojo in Uganda developed the District Costed Implementation Plan for Family Planning. In 3 years, the two districts allocated $94,231 to family planning. Despite the investment made, family planning indicators have remained poor in the two districts. Poor family planning indicators could also lead to abortion and conflict over resources. Weak accountability processes have resulted to low allocation, untimely disbursement, and poor absorption of the public funds for family planning. However, Accountability of family planning funds at all stages is essential, ensuring that the rural population of Chenjojo and Mitiana access high-quality family planning information, services, and commodities, thus improving their quality of life. Budget analysis for Mitiana and Chenjojo shows interesting trends and patterns regarding allocation, disbursement, expenditure, and absorption of family planning funds.
The district depends on its donors, the activities will not be done.
It was utilization of CIP in informing district family planning budget.
Disbursement of health budget from the central government to the district is not timely. The disbursement is never 100%.
When funds are not used, automatically the communities will not be transformed.
We, faith and religious leaders, note that the district has no dedicated budget line for family planning. There are delayed and reduced disbursements of funds for health and family planning to health facilities. The district costed implementation plan is not informing planning and budgeting for family planning in the district. There is low absorption of health or family planning funds at facility level. There is over-dependence on donors for family planning funds. We faith and religious leaders recommend
we are allocating certain amount of money, for example, maybe it could be 10 million for family planning and is specifically for family planning.
They are not aware of the DCIP, so they are not using it for planning. We recommend that the district support engagement to engage with the central government to ensure prompt, timely and full disbursement of the health budget.
It means we must encourage the districts to generate revenue.
The district should have a dedicated budget lane for family planning. The district should ensure prompt, timely and full disbursement of the health family planning funds to the healthy facilities.
Health facilities to develop robust mechanisms for monitoring, utilization and accountability for health family planning funds. The district to ensure prompt, timely and full disbursements of health or family planning funds to health facilities.
And since I was here during the time of introduction, let me just acknowledge the protocol so that I can be able to stay within my 5 minutes. But I want to recognize the members of parliament, the senior religious leaders, and the board members. First, I'm happy for the organizers of this function, where we are looking at routing for policy actions, where we family leaders reconstruct family planning investment in Uganda. All of you are aware that in 2012-2017, during the London Summit in Family Planning, Uganda renewed its commitment to FP 2020, and this includes new financial commitment efforts to scale up health services provision and increasing availability of modern contraceptive methods. Subsequent to this, the commitment of government was developed into a national family planning costed implementation plan at national level, and then we roll out into the districts, of which you have had the districts having their district implementation plan, in which they allocate resources for family planning. And there has been a minimal alignment between the commitments and the financial allocation, as has been shown by the survey which was done by Faith for Health initiative, and which sought to track the linkage between family planning allocation, disbursement, and absorption. And so we need to be able to look at the whole cycle, because we've been concentrating more in aspect of allocation, but definitely we need to also look at that. There are this aspect of absorption and translating this to the actual service delivery. So this dissemination and learning session is coming at a very good time when the Ministry of Health is in the process of developing a new costed implementation plan. And also, we are also reviewing. And I'm happy to note that Moses Muonge, who happens actually to be, is one of those who is working with the Ministry of Health in developing a new costed plan. And I wanted first to take that. I hope he has got the views of this constituency and they are being implemented. And I think he's nodding in affirmative, so it means that he has been able to do that. But allow me, Chair, within this short time, to run you through what have we been able to achieve in the costed implementation plan which ended. And I will look at about 6 thematic areas. On the demand creation, definitely we have had the National Family Planning Communication Strategy. We have had male involvement. We have put out guidelines, several guidelines, and we have had engagement of religious and cultural leaders. In terms of service delivery, we have definitely been able to do in-service training. We have improved quantification of and forecasting on the side of contraceptive security. And in terms of policy, definitely we have had the SB policy, strategy, and male engagement and sexual education framework, among others. On financing, government has committed more resources, but I'm looking at that this will be one of the suggestions which we need to be able to see that we follow through just not only allocation, but also look at the absorption and actually that this being able to be translated to actual service delivery. Chair, allow me just to highlight that now coming to the next CIP, what are our priorities? Our priorities definitely run in, I will not be able to go in details, but I'll run them through thematic areas. Definitely will be adolescents and young people, adolescents in tertiary institutions, populations in refugee communities, people with disabilities, and this is definitely on the side of the demand, on the demand side. We also have aspect of religious leaders, which were, and cultural and community leaders, which we think that we should be able to work in branding family planning terminology to all those Sudaners and also address the knowledge gap. In terms of service delivery, we have definitely seen that there has been regional disparities, so we think that we should be able to close those gaps. And I think we've had poor dissemination of policy and legal framework, and I think this, which interface and for family planning, families, is one of those which we are looking. On financing, I'm happy that members of parliament are here, and we're looking at it. We need to work and see how would we resource family planning, as we say. So, Chair and ladies and gentlemen, this dissemination learning is timely as we move to the next costed implementation plan, and we will be able to draw lessons from this to be able that we can be able to perform better in the next period of implementation of the costed plan. And the ministry pledges to work with the faith-based organization and all those stakeholders in family planning. Lastly, I want to appreciate the organizers of this for today presenting these models, and I think the models which we've seen in Chenjojo and Mikiana with my colleague, Dr. the DHO, we should be able to roll them to the rest of the country. Thank you very much for listening.
honorable members of parliament, religious leaders, organizers of this meeting, ladies and gentlemen, good afternoon. I would like to express my apology for coming in late. We have lost another prominent Muslim member who has been the national chairman for the Uganda Muslim School Council. He passed on yesterday, succumbed to COVID. So we had a service for him this afternoon, as he's going to be buried later in the evening. I would like to thank all of you for devoting your time to this meeting, and I would like to begin by saying that as of 2014, Uganda's population stood at 34.6 million people. The country's population was growing at an average rate of 3%, and the number of people per household was 4.7 on average, according to Uganda National Population and Housing Census 2018. An estimated 1 million people are added to the population each year. As such, the population of Uganda is expected to hit the 41.2 million mark by the end of 2020. The main driver of Uganda's population growth is its high fertility rate that stands at 6.2, the highest in the East African region. This is largely due to low access to modern contraceptives by women and girls of reproductive age. Uganda continues to reflect a low government investment in family planning infrastructure, leading to poor health outcomes among women and young people of reproductive age. The prioritization of family planning visibility, pervasive stock-outs due to poor ordering at facilities, limited provision of family planning services, particularly long-term contraceptive methods in hard-to-reach communities, and low coverage of friendly family planning services for adolescents, socio-economic situations, geographical location, and marital status. There is a demand and a need for family planning in Uganda that is simply not met, yet clear counter efforts have been made in the past decades to address this gap. With more resources to scale up existing and new interventions and systems, a grand convergence in health, as outlined by the Lancet Commission on Investing in Health SIH, will be possible in the near future, resulting in enormous social and economic returns. Indeed, investments in global health save and improve millions of lives, create economic gains, and alleviate extreme poverty. In 2012 and in 2017, during the London Summit on Family Planning, Uganda renewed her commitments to Family Planning 2020. This includes new financial commitments, efforts to scale up health services provisions. And increasing the availability of modern contraceptive methods. Subsequent to the commitments, the government of Uganda developed National Family Planning Costed Implementation Plan as national roadmaps to attain full access to family planning and eliminate the unmet need. Thereafter,
Each of the districts would develop their own district costed implementation plan for family planning to guide the district in resource allocation for family planning and improve performance. However, there has been a markedly minimal alignment between commitments and the financial allocation to implement them. While most districts in Uganda have developed DCIPS and funds allocated to family planning, for example, in the 8 districts supported by 3 Family for Health initiative, over 840 million Uganda shillings were allocated. The district governments have failed to align their health budgets to match family planning commitments and improve family planning performance. The situation has been worsened by the outbreak of COVID-19 pandemic, leading competing resources on the already constrained budget. Accountability and assessments in Mityana and Kyenjojo, key findings and conclusion. The recent survey done by Faith for Family Health Initiative and which sought to track the linkage between family planning allocation, disbursements and absorption found that there was a huge challenge in translating family planning allocations into actual service delivery. Analysis of the family planning investment in Mityana and Kyenjojo along the allocation disbursement absorption continuum revealed an interesting trend and pattern. The various accountability variables, including allocation, disbursements, and absorption, which are contained in a report entitled Participatory Budget Analysis for Mityana and Kyenjojo for 3 Family Health Initiative 2020, contains the work of the faith and religious leaders reviewing various policies, plans, budgets, and performance documents to deconstruct the state of family planning investments in Mityana and Kyenjojo districts. In the 2 districts, the findings were similar and portrayed a number of gaps. DCIP is not embedded into law nor district plans and is therefore not informing family planning allocations and district plans. Districts do not have a clear family planning budget line, family planning allocations, and are not protected, and instances when they drop, even when there is an increase in allocation to health sector, it is not clear what percentage of health program budgets is spent on family planning service provision. Delayed and reduced disbursements of funds to health facilities is leading to stock outs, while there is a delayed, reduced and untimely disbursement of family planning funds by the district government. Project dissemination and learning meeting. This learning meeting has been organized by 3 Family Health Initiative to support learning and sharing across regions. The 3-hour virtual and physical meeting would present an opportunity for the participants to interrogate the findings of the accountability assessment and learn about the practical outworking of the faith-led social accountability model for family planning. The social accountability model of family planning places high premium on the advocacy interventions across the allocation, disbursement, absorption, and performance continuum. Importantly, It looks at both investments and performance. The model seeks to address accountability issues noted in the accountability assessment for family planning in Mityana and Kyenjojo. I wish to invite all of you to this interactive meeting. Learn, share, inspire, and engage. Thank you for listening to me.
Thank you very much, and I'd like to confirm with the IT team whether people are online. We have a very big constituency, including our donors that are locked out, and I think it would not be prudent. So can I confirm if we've been able to sort that problem? We are sorted. Good. Thank you very much once again for coming. As I earlier said, the 3FHI model is an interfaith-led budget advocacy and accountability model. Some of us, we come in for technical assistance, but as you see, most of the presenters and the implementers are faith-based organizations and led by the interfaith religious leaders. I'll start, I'll use what I have here. I think some we should have started from the introduction. The expenditure account project had the purpose to empower community to engage with decision makers for accountability of family planning. So I'm trying to talk to this project that has brought us here. But before this project, we had a series of other projects, as we saw in the video. We started with budget advocacy in 8 districts, working with a number of faith-based institutions. Some of them are not implemented here, and that was funded by Population Action International. And then we had a national advocacy by UN Foundation, or FP 2020, and one of the key deliverables out of that project was the Interfaith Alliance for Family Planning, and that's why we are able now to have these dialogues at the national level. So it accelerated advocacy from subnational to national level. Now, just like most of the advocates who are in this room, I'm glad we have most of the key advocates. We have Samasha, we have PPDRO, and many others who have started this work over time. We're asking ourselves, we are advocating for increment of family planning budgets. But so what? Are we seeing increase and improvement in performance of family planning indicators? Why don't we try to follow up? And the current partner who has funded this meeting, called New Venture Fund, supported us to pilot in 2 districts, and that was Kyenjojo and Mityana. And we are here today to disseminate the findings, share learnings, but also many of us in this room, we've been in this field and would like to really hear on how we can improve this model. So I'll quickly run through the expenditure account. That was the name of the project. It was to empower faith community leaders to engage with decision makers for accountability. And what led to that? We realized that there was unmet needs at all levels, and therefore, unmet need for family planning. Therefore, there was need to build the capacity of faith leaders and community at large to conduct social accountability of FP investments for socio-economic prosperity. In the videos that we saw, you saw most of the interfaith leaders actually analyzing district budgets, district work plans, district performance reports, and trying to find out this is what was allocated, but what was spent, and if it was spent what has improved. So it supported, one, we built the capacity of religious leaders. We had a 5 days training with 10 interfaith leaders from Chenjojo and Mitiana, and we took them through budget tracking, monitoring. At first, we thought that religious leaders would not be able to handle figures, but they surprised us. You heard their voices saying, we don't see this, we don't see this. So they were able to do that, but they had the support of a consultant who was helping them to analyze. So they formed faith accountability hubs, and in the introduction we had what we call district interfaith councils. That was their hub, well coordinated. And then they had support social accountability dialogues. After getting the data, as I will talk to it, and the impact has been increasing the capacity of faith leaders on social accountability, and that would lead to better budget disbursement and improved FP information and service delivery. Definitely, that would lead to reducing abortion cases, unintended pregnancy, maternal mortality, and in the long run, leading to better socio-economic well-being. So that's how our approach was, and that's how it started. And now I'll delve into how did we proceed and what are the other things that we did. Slide 2. The next slide. So this is the logic. If I remember, I might need to use my laptop. I try to avoid the other lenses, but the distance is becoming really long for me. So the activities that were done, one was evidence generation. We had a study done. We had a budget tracking and monitoring study done. If you check in your files, you see a fact sheet with the findings, and later we'll get from some of the DICs presenting the findings of that study. Then we had participatory budget expenditure and performance analysis, hands-on, as I already said, and then routine service data analysis. We also built the capacity of religious leaders. Throughout this process, we've been using what we call AFP SMART approach, advanced family planning, because it has proved that it's simple and easy to learn, and it has really changed most of the religious leaders as family planning and other champions in health. Investment and performance analysis. Then we had media engagement. Most of you have visited our website, you can really tell, and we've had a group of media people that we've worked with. I can see in the room there is Elsa and Harriet. They are seated there. So we trained them and moved with them. When they write articles on health as health experts, but also understanding the faith and the technical aspects. We also strengthened alliance building and interagency coordination for the collection action. This was not only interfaith-led, we worked with civil society organizations, the ones that are in the room, and many others that could be online. So we worked through alliance. Advocacy is collective action. You cannot speak alone. You need other people, you need also experts add on your knowledge. Then we did social and mainstream media engagement. I talked about it. What was the outputs? We had evidence generated for advocacy and accountability. I told you we have fact sheets and the detailed reports are there. We have champions. We are proud. Actually, we don't need to be in this room. These religious leaders can fully engage on budget, advocacy, and accountability because now they are fully recruited champions. Formation of accountability teams, hubs and interagency and faith councils. Then we had increased visibility of FP accountability initiatives. Where we worked, I know most of our district colleagues know what happened, and also it became a priority. Definitely, as I said, we didn't work alone. In each of these districts, there are other civil society organizations that are working there, and some of them are actually doing budget advocacy. So we worked as a team, but our approach was interfaith-led. Then short outcomes. Faith leaders have voice and agency. Then we had increased commitment by decision makers on FP. And thank you so much. In these two districts and many others, I know when Dr. Rwasampija and Honorable Bagaba, they will tell you how they allocated the amount of money. It was really very impressive how they responded to that. Increased knowledge on social accountability, and then intermediary, we had the improved accountability of public spending of FP funds. And then increased investment and performance, improved service delivery for FP. And we are looking forward, this one is not yet measured, but the impact is reduced maternal mortality rate. Maybe that's where now we are going. Once we clear the issues of accountability, then we should be able to see the impact. The next one. So the approach is called social accountability model for family planning. And those were the problems. I don't need to repeat them really. Most of us who have been in this, they've been our cry. And as they said, I'm sure now Dr. Mong, I don't know, you're still putting figures and trying to see how we've progressed in the CIP and how we can do better. And I already said the solution was citizen advanced social accountability dialogue, investments and performance. In summary, it was evidence generation because religious leaders needed to really see that there's a problem, and also they're able to engage. Champion building, accountability teams, alliance building, media engagement, and social accountability. And then we had improved investment and performance, and then better FP indicators and better quality of life. But as I said, the impact, there's no evidence yet. The studies that are going on are going to be able to tell. And the leaders who are in this room would be happy to see the indicators, for example, maternal mortality rate, unmet needs, MCPR, when we have major studies done, like UDHS, to see that Mitiana and Chenjojo has improved. That will show us that all of us who did that work, who worked with a district, we've had a contribution in that district. Next slide. I'm done with that. Key features of the model. 1, empower citizens, faith and community leadership to engage with the decision makers for accountability of FP funding. And most of you attended these dialogues. We would like to really appreciate our leaders. The ministry was with us. The government, Dr. Betty Wright from FP Smart in many years ago. The CSOs, the MPs. So it has been collective action to be able to implement this model. Focus on investments, budget increase, but again take it beyond to funds absorption and service delivery. I don't know how many can look at this, but this has been, in summary, our approach. We said, okay, thank you so much, Dr. Rasa, for giving us 270 million for FP. But again, we're asking you, was this disbursed? This giving it to you and it is not disbursed. Then if it was disbursed, did you spend it? And if you spent it, was it spent on the right needs? For example, we did before we did the DCIPs that were done, we are looking at the real needs. You could find that some of it is demand generation, but again, when it comes to spending, we are spending on another need. And that is a need also, but was it a priority for the district? So we are trying to interrogate, was the expenditure in line with the FP needs in the district? And then absorption. They will tell you what we discovered. And eventually, if these are done, we would see improved quality of life. So that was our approach to the expenditure account project. Then establish community-based advocacy and accountability teams. We already talked about it. We demystified accountability, citizen government officials participating in budget expenditure, budget analysis to identify progress drivers and barriers. With all due respect, I know many people are here, Dr. Lara is here and Betty, but our experience is not easy when we go to our district, starting on accountability. Actually, most people think we are sent from IGG office. So to explain the concept, to demystify that we are here to address the needs, but that was not the case with Chenjojo and Mitiana, but we've made it somewhere where they even try to make background check whether you've been sent from IGG's office to come and investigate. But we try to say it's going to help all of us to improve these indicators. Citizens conduct policy analysis of the existing policy standards, frameworks, and identify issues. And again, thank you so much. If there's anything difficult, I don't know how many people have declared my income to in this world. If there's any difficult question, is someone asking you, how much is your income? So you can imagine to go to the district and say, what did you get? What did you spend? What did you spend it on? So, but you gave us all this information with ease. That's transparency, and that's really a key learning, and that's the way to go. Then we build wider support through micro-consultative dialogue and media engagements, deepen use of social accountability tools, community facility assessments, generating citizen community scorecard on FP service delivery. One thing that surprised us, our dear religious leaders, not because we underrate you, but you surprised us. Because when we're doing facility assessments and budget tracking, we could not expect you to understand that these are the indicators, this is what you planned under this, and now we are following to see how you spent it and follow it up to the end. So we really appreciate your level of interest, but also technical skill of the current and modern faith leaders that we have. Thank you so much. Policy decision makers are intensively involved in every step. By the way, most of this, we are here, but it's not our work. You can ask them. We just come and work with them, but they've been on top of everything. That's why they are comfortable. That's why they will say, we are going to say all these things. Some of them are even not very nice. But they say, yes, we are okay, we are together in this. Even if it's not very nice, let's work together, let's fix it. That shows involvement and intensive collaboration. Then joint citizen executives and elected leaders, planning of policy commitments are secured. We have had a lot of commitments. You saw even in the video where our leaders committed. But not only that, we also worked with executives, the council. And that's why we have, when Honorable Gaba talks about budget advocacy and accountability, you might think he's one of those trained experts. But they've been with us. So when it comes from the technical people, the DHO, by the time it gets to the council, there is already support. So that's a whole comprehensive approach of engaging decision makers to get buy-in, commitment to be able to achieve the objectives. Follow-up institutionalized to track implementation of the gender advocacy action plans, and we've had most of these plans developed, and we have even roadmaps that are being implemented and easily replicated. So 3FHI has deployed this model and beyond family planning. So effective September, we are replicating it under a project. It's called Thrive. It's on adolescent health, but it's on women, children, and adolescent health. Again, Father is here. Father is the coordinator of the interfaith. Father stands for recognition. And kindly pass on our condolences. One of our interfaith leaders who is part of this, the Archdeacon of Revisengo, person, I think they are burying today, pass on our condolences. So they again surprised us, because for them it was not only family planning. They had 3 areas: women, children, and adolescent health. And then they said, you're wasting our time. Issues of adolescent health are so huge here. This is where we want to be, and that's where we are. But of course, family planning remains a springboard. So we are replicating it beyond family planning. And if there is anything that any one of us feel that we can adopt, and we also learn or even come and we improve it, we are really glad to share, to learn. My mentor, Dr. Betty, tells me that advocacy, what did you say? I've forgotten the word. She told me that you can't own advocacy, it's a joint voice. But there's how she packaged it, I forgot. It was one single word. So you cannot say, me, I did this, it's mine, so for you start from here, me, I stopped here. No, it's joint effort. Let's all make sure that we improve investments and performance of FP and beyond. Thank you so much.
In order to save time, we'll go ahead and move into our panel discussions. And we'll begin with panel discussion 1. We have 2. We have 1 and 2. And so let's begin with panel discussion 1. And the topic is going to be introduced by Jackie Steele, but I would like to at least at this particular time invite the panelists to take their seats, and there are 4 of them. Please welcome Honorable Beatrice Wachimari, Member of Parliament, who is also a member of Health Committee of the Parliament of Uganda. Please put your hands together and welcome Honorable Beatrice Wachimari. Please take your seat. You may sit on the far my right. My right. Okay, it is your left, but it's my right. Thank you. Also, join me, and we welcome Dr. Moses Muwonge, who is the Executive Director, Samasha Medical Foundation, and this is going to be the CSO representative. Please welcome him. And then also we have Dr. Betty Chadondo, Director, Family Health, which is the National Population Council. Please welcome Dr. Betty Chadondo. And then we also have Ms. Alice Lubama, who is the media expert, and is going to represent the media. Welcome. Please join me in welcome Ms. Alice Lubama. We don't have enough microphones, which means you have to do more work of sanitizing and passing on these microphones. Before I invite Mrs. Jackie Katana to introduce the topic. Let's first get to know these panelists. I would like to request you, each one of you, to mention your name, the organization or institution you represent, your role on that organization, in that organization or institution, and then, or if possible, tell us, you as an individual or through your organization, what you do in promoting family planning in Uganda, but also you may talk about your personal journey of this model which we are disseminating and learning. Let's begin with Honorable. When you finish introducing yourself, sometimes the microphone, pass it on to the next panelist, please. Thank you.
Thank you very much, my Lord Bishop. My name is Beatrice Rwachimari. I am a district woman, member of parliament from Tungamo district. But I also sit on the health committee of parliament. And I'm also a board member for this great organization.
What about your journey or what you do as an individual in promoting family planning in Uganda? Let's finish all that and then even talk about your journey briefly.
Thank you for that reminder.
Okay.
First of all, as a committee of parliament where I am a member, we have been working very, very hard to lobby government to ensure that the budget for family planning is increased. Family planning and reproductive health commodities. And I'm proud to say that we have done well, and the budget has been increasing subsequently. But also at individual level, I founded an organization in my district called Arise, and we are dealing with advocacy at the district level. We engage with the communities to talk about the advantages of family planning and why families should get involved in family planning in order to improve their health and their socio-economic status. So both at national level as a member of parliament, but also at individual level, by founding that organization, a lot in family planning advocacy has been achieved.
Thank you very much. Thank you very much. Next.
Thank you, Your Lordship. My names are Moses Mwonge, and I'm the director of Samasha, a civil society organization that is headquartered in Kampala here, but operating in more than 8 countries, including Asia. We have a project we're implementing in Indonesia. But we're here to talk about budget advocacy and accountability. My journey in that area started way back in 1990. And at that time, we were faced with an issue of stockouts of family planning products and reproductive health commodities in general. Governments were not allocating resources for procurement of these commodities. And in the 90s, the big advocacy agenda was to create budget line for commodities. And good enough, UNFP and other agencies really worked hard and made sure that countries created budget lines. And Uganda created the reproductive health commodities budget line, which was a good plus. However, in around 2000 or end of 1990, we realized that even if governments create a budget line, they don't put money in that budget line. So we started now another phase of advocacy to see that government allocate resources for commodities. And then we continue progressing, and then we realized that actually tracking allocation was very difficult. And so I myself, Dr. Mwonge Samasha, and PAI, we developed what we call the 11-step guide to budget tracking for contraceptives. And it is being implemented in different countries. And in 2012, we realized that from 2012 up now, we've realized that time we focused on commodities, but the programs are not being funded. And you cannot have people not coming for commodities, and then you have overstocks. So we're now moving into, again, tracking commodities. And that was at national level, programs at national level. But then as we're doing that, we realized, oh, okay, we are focusing at national level, but the districts are not putting in money. So that's where we are here now. So this work we are doing now, and I want to say that we've also developed what we call the common framework for tracking commodities, which I think is mutated into this model. And we are trying to say allocation alone is not enough. We need to really look at, track the money until it is spent. So that's the journey that I've been in, and I'm glad to be here today.
Thank you so much, Dr. Moses. We really appreciate that information. Next.
Thank you very much, Your Lord Bishop, and good afternoon, colleagues, ladies and gentlemen. My name is Betty Chadondo. I'm afraid to say Chadondo because people are associated with Chadondo East, but nonetheless, it remains my name. And I'm very privileged, and thank you, Faithful Family Health Initiative, for inviting us to talk about what we do, and also probably what we plan to do. So I am the Director of Family Health at the National Population Council, and I have also been given a name, Mama Didi. So my work with family planning these days is beyond health, and is looking at how family planning can help the country achieve the so-called demographic dividend, which is an economic benefit that the country accrues from investing in the young people. So what we do at the National Population Council is mainly three things. One, which is around advocacy, is to ensure that we hold policy dialogues around the population dynamics and how they impact or they deny the countries from attaining the Vision 2040 for Uganda, but also all our development aspirations. And we dialogue with different categories of people, including members of parliament, including religious leaders, including cultural institutions, but also the media, and lower down, we also hold these dialogues with the district stakeholders, and we hope we have also contributed to the advancing of budget advocacy and accountability for family planning. We also endeavor to increase awareness on why it is important for countries to invest in family planning, but also why it is important for individuals to consider family planning not only as a health, not only for health benefits, but for overall development of individuals' lives, their families, their communities, as well as the nation at large. And lastly, the most difficult part that we do, advocacy is difficult. It cannot be done alone, as Jackie has said, but integrating family planning into development plans and budgets is one of the things that we have been grappling with, because appreciating and understanding that family planning is important is a perception for so many people. Some people seem to perceive it easily, that family planning is good. Other people perceive it differently, that family planning is not important for various reasons. And this, therefore, makes it difficult for us to ensure that this is integrated in the different plans and budgets at different levels. We are very, very privileged now that the country has taken on the new planning and budgeting architecture, where programs have been put into the third national development plan, and the issues of importance have been catered for within the different program implementation plans. And in program 14, which is a human capital development, reducing fertility has been given prominence. So we hope that probably over the next 5 years, our indicators will be better,
and we shall be seeing the change that many of us around the room are yearning to see. Thank you very much.
You are answering questions, just try to be brief.
Okay.
Next.
Thank you so much, sir. My name is Uncle Alice Owano, and I'm a senior journalist working in Capital Radio and Beat FM. I've been in the media for quite some time, more than 10 years. I've been working with reporting at Parliament, but specifically reporting on reproductive health matters. I've been working with the Health Committee and engaging the lawmakers on the issues to do with reproductive health. I got to know Faith for Family Health through the Health Committee, and from that time I started my journey working with this organization. I've done a number of stories with this organization. I've engaged the religious leaders, including the current Archbishop of Uganda, Dr. Stephen Kazimba, when he was still at Michiana Diocese. At first, it was not easy to work with religious leaders, but after engaging them for some time, I'm now able to do some stories with religious leaders concerning advocacy on family planning. Thank you.
Thank you very much. Is it important that Uganda or many other countries ought to invest in family planning?
Thank you very much for that great question. Uganda being a developing country with a very high rate of population growth, I feel that if we are to develop as a country, we need to manage this population. And we can only manage this population by applying or using family planning. And we need to do this in order to bring down our fertility rate. As one of the speakers has said, 6.2 as fertility rate for Uganda is still very high. Our neighbors, Kenya and Tanzania and other East African countries are already at 3 point something, 3.2, 3.5, and they are doing very well in aspects of socio-economic development. So I feel that Uganda as a country, we need to reduce our total fertility rate. We need to reduce the high rates of abortion in this country, and this can only be done through use of family planning. We need to bring down adolescent pregnancies. We need to bring down all the unwanted pregnancies among the women. So in short, if we are to improve the health of women, the health of communities, there is need to invest in family planning. And at the end of the day, we shall be able to bring down high maternal mortality, which is our greatest problem, our greatest bottleneck to development as a country. So as members of parliament, religious leaders, and all stakeholders interested in developing this country, we need to work together to ensure that we invest in family planning and reproductive health commodities, but not only investing, but continue to follow up as we have been told. Look at the disbursement, look at the expenditure, look at the absorption, and finally look at the quality of service in our communities.
Thank you very much. We appreciate that response. We are discussing.
And ladies and gentlemen, every time you invest in anything, you expect to see a result. And from a technical perspective, every program that we develop or project, we have a results framework for it. And within a results framework, you want to see, you have a goal, you have an impact or many impacts, and you have the outputs and all that you're inputting or where you're investing for you to achieve the result. So I think why it is important for us to shift from just merely looking at investments to looking at the results is because that is the change that we are all yearning to see. Honorable has taken us through why it is important to invest in family planning. And for as long as we don't see this change, for as long as we don't see maternal mortality, infant mortality, for as long as we don't see poverty reducing, for as long as we continue to see girls getting pregnant when they are teenagers, then we haven't done anything. So it is important that even as we are planning to invest in family planning, we have at the back of our minds the results that we want to see. And unless we get this country on that path of reducing fertility, of reducing both child mortality and maternal mortality, we haven't invested well enough into family planning. So that is what I can speak about.
Thank you very much. We appreciate that. Rishi's view. Do you think that all actors in family planning have all along emphasized on investments and missed the performance bit? Do you consider this as the missing link? Why is this performance dimension important?
Thank you, Your Lordship. I like Jackie, she talked about accountability. This is an accountability project. And if you go to the definition of accountability, it's basically holding power holders for the actions that they take. And those actions and the power holders are classified into three. They are finances, program, and politics. Now, what we've been focusing on as civil society is finances. We've been focusing on tracking. You can see that those staircases, money. But we've not been focusing on the program. And the program is how you get results. And as Dr. Betty said, we talk of investments, that's money. Human resource is in program. So if we don't look at the program as an accountability area, that's how we're starting to miss the point. The other area that we've worked on as civil society very well is politics. We have Honorable Member of Parliament here. We've engaged the Health Services Committee. So the politics part of it we've handled as a component of accountability and advocacy. But we failed to handle the program component. And Your Lordship, what I'm saying now is that bus that we've been missing of program accountability is where we need to look for results. Thank you.
Thank you very much. We appreciate your response. Now to you, Ms. Alice Rubama. Can this investment and performance become a national family planning agenda? What can the media actually do, and how do you think they can do it?
Thank you very much for the question. I think what the media can do is to follow up the investments in family planning, how the money has been invested, how the money has been used, if the money has reached the end users, and even be able to report on it. Sometimes we stop at when something has been launched, like the second costed implementation plan has been launched in some district. Sometimes we stop at the launch and we don't follow up to the grassroots. But sometimes it's because of facilitation. The media who would have been interested to follow up on this cannot reach those areas. Maybe to do some investigations, talk to the real people where these services go, then get that real information. And the other thing, sometimes we don't get that real information, like how much money has been released for family planning, like for a particular district. Like I was in Chenjejo when they were making a review for the impact of the costed implementation plan for family planning, how it had performed in that district. But there were several concerns by both the health workers and the district leaders. They had concerns like delay of releasing the funds, like the funds are disbursed late by the ministry. So at times it's very difficult for them to use these funds. So like when you are in Kampala, like a reporter like in Kampala, you cannot get that information unless you go to the ground. Thank you.
Okay, thank you very much. Of course, there are several issues and factors on media houses, and some of them being, is that a real the real news? Would it attract the public? And you look for those events and activities which would sell your papers or attract the public, and probably you don't see family planning as something that would that important information that the community or the public would benefit from. So continue to think about that as media representative and discuss with all other media houses, so that you also become the advocates of family planning. Now we can go ahead and shift gears to accountability puzzle. I would like to now request my co-moderator Jackie to help us mention something about that, and then also move us in the next round of questions. This one.
And
for the good first phase moderation. We are shifting budget advocacy to accountability dialogues. And as we all know, for the last couple of years, the advocates and champions of family planning advanced budget advocacy agenda. In that, the focus was on budget increase, and we really did that. This is what we called budget advocacy model. The model was or is well premised on notion that increased allocation of domestic financial resources to FP would lead to overall improvement in FP indicators, and that would need to reduce fertility rate, family size, and increase of modern contraceptives, reduce unmet need, and times this has not been easy. As we reflect on the findings of the accountability assessments in the 2 districts of Mityana and Chenjejo, this call on us to question the old paradigm that merely focus on budget increase. There is need to shift our focus to accountability, as in my areas, performance issues we just mentioned are closely linked to the accountability puzzle. And Dr. Moses clearly said that the accountability agenda helps government to examine the result, output, and profit of their investments. It leads us to question whether the investments made are producing desired results. We will therefore examine key findings of this analysis and see whether they've been able to create another pathway to budget advocacy, shifting us to accountability. I'll again start with you, Dr. Muwonge. You've been supporting national and district government to develop family planning costed implementation plans for some time. You developed the first one, is expired, and we are very well aware you're again the leader for this one that we are reviewing. And this one guides government in planning, budgeting for FP. Actually, it guides the government use allocation of FP resources. Sadly, our findings in Mityana and other districts, we've realized that this CIP is not informing district plans and budget for FP. And some of these documents are not referred to. And my question from experience is, where did we go wrong? That's question 1. Question 2, what role can the development and civil society actors play to ensure that government utilizes these policy documents in FP planning and budgeting? And finally, do you have any message to the government on why they should use these DCIPs in family planning and budgeting? Thank you. Over to you, Doctor.
Thank you, Jackie. Uganda developed its first CIP, national CIP, in 2015. And it has just ended this year. But what we found, and the evaluation that was carried out by a team, found that the national CIP mainly looked at family planning as a health issue. And so if you go to Ministry of Education, Ministry of Gender, they said, no, family planning, you go to Ministry of Health, which we felt was misplacing family planning, because family planning cuts across all sectors. The other issue that we found is that the family planning costed implementation plan that we developed never took into consideration the regional disparities. Kigezi region is different from Karamoja region, from West Nile. Teenage pregnancies are very high in West Nile, but in Busoga you may find the reason for teenage pregnancy is different. So we never took into consideration that. Now, when we went to the district level, the districts, when they were developing their CIPs, did not have a reference point within the national CIP, because the national CIP had lumped them among all the districts. So even it became difficult to get indicators for the district. Even as Jackie, you talk about program indicators, most likely I think you mean HMIS data. But you're not talking about this, the contraceptive prevalence rate, the unmet need for the district. Because we never, at national level, looked at the region or the district. Even right now, PMA is carrying out, they track contraceptive prevalence rate, and annually. But we don't have district level. So however much we do, we don't have that data. The second issue that complicates the CIP at district level is that within the district structure, we still positioned the district CIP as a health issue to be implemented by the district health officer. For instance, Dr. Rasa is now in charge of implementing the Mitiana district CIP. So the same mistake we created at national level was repeated at the district level. And then, while we are positioning the CIP as an advocacy and resource mobilization tool, we didn't actually galvanize even other stakeholders within the districts outside, like implementing partners around the CIP. We mainly put all our money into the district health officer to make sure that the CIP is funded, and the district health officer want to convince everyone. Now, I have to say that we tried to alleviate that by making sure that the district passes the DCIP through the council and the CAO and the LC5. But that was, to me, ceremonial. When the ceremony ended, it became the district health officer to make sure that that moves. The other aspect I want to say is that civil society organization, we talk too much to ourselves. So when we come here and strategize, we develop these models, then we go and attack Rasa. With our models, how we assume he's going to achieve his budget tracking and all that. We never consider building stewardship capacities on the other side. And I think we've been missing that. We assume that the district health office knows what you're talking about. They know the importance of family planning, so we just come in to hold them accountable. And I think the next phase, as we modify the model, how can we build capacity within the government officials, the different sectors in the district? The way we build capacity for the religious leaders, we've built capacity for political leaders, but have we built capacity for the local council within the district? All those things work in tandem to be able to deliver the CIP objectives. And that brings me back to the issue of accountability for program, accountability for politics, and accountability for finances. So thank you so much.
Well exhausted and thanks disbursement for health, including family planning from the central government to the district treasury, were overly delayed. And even what was disbursed was not 100%. Other issues noted in the study included reduced healthy budget as a national budget, which affected health and FP budget. Can the ring fencing policy be enforced at the district? 3, given practical measures, give us practical measures, interventions on how we can, accountability for FP funds can be ensured, increased, allocated, the prompt disbursement, better absorption, both at national and district level. Maybe to add on ring fencing, the study showed that even those funds that were allocated to family planning, they were liable to go to address other emergencies. So they're not ring fenced, they are not protected. They are those funds that you can easily say, if COVID has come, it kills instantly, but family planning doesn't kill instantly. Thank you. Over to you, Honorable.
Thank you very much, Jackie, for that question. First of all, like one of us has already mentioned, family planning issue is cross-cutting, it is multi-sector. So it cannot be limited to only Ministry of Health. We need to see other ministries like Ministry of Gender, Social Development, Ministry of Education, and other stakeholders getting involved to ensure that we get adequate budgets for family planning. I would also like to agree with you that most times the money for family planning is disbursed late. Even as a parliamentary committee of health, we are concerned. I've not come here to lament with you, but just state facts. We have also been greatly concerned about the prioritization of funding in Ministry of Health. As Parliament, we can increase the allocation for family planning and reproductive health in the budget for Ministry of Health. But we also get surprised, by the way, when sometimes this money is allocated to other priority areas in the Ministry of Health. So, as a committee of Parliament, I think it is our responsibility, it is our role to make follow-up and ensure that money which has been allocated to family planning is strictly spent on issues on issues of family planning and reproductive health. So one of the ways to ensure that we achieve this is for the Committee of Health to be more vigilant. Since oversight is also our function, it is our responsibility to ensure that the Ministry of Health does not divert this money, which is already inadequate to do what we want to do in the area of family planning. The same goes with late disbursements. It is true that this money is also lately disbursed because, as you realize, by the way, whether at national level, district level, or community level, issues of family planning and reproductive health, maternal health, are not priority issues. I'm sure Faith for Family Health organization must have realized this when they are working with communities. Even in my district in Tungamo, however much you try to bring them on board to prioritize issues of family planning, they are like, but these are women issues, not knowing that women's issues are development issues. So my pledge is that as a committee, again, we shall make follow-up, first of all, ensure that the money goes for family planning activities, two, that the money is disbursed in time to be able to do the work that it is supposed to do. But also, like Dr. Monge has said, and I'm glad he spoke the way he did, because what he said is maybe partly because we have not achieved our, is it 50% target?
Yes, target.
We are still struggling at 36 something? Yes, modern family planning contraceptive, something like that. And the issues you have ably articulated are some of the bottlenecks to the achievement of that target. Yeah, because as I've already mentioned, we have tended to concentrate at national level, boardroom engagements. At national level, we are super. Our capacities, our understanding and articulation of issues is very high. But this is not the case at district level, let alone at sub-county and community level. So for me, I think we need to balance our approaches. Much as we are engaging ourselves here, they already converted. We need to engage the communities because those are the greatest beneficiaries. We are talking about accountability, but once the communities appreciate the benefits of family planning, I believe they will be able to help us to push our agenda. They will be concerned with the late disbursements of funds. They will be concerned with the absence of family planning budgets at the district level. So My advice is, or my way forward is, as a civil society organization, we need to go deeper. We are already doing well engaging the religious demand right from the communities to the sub-county, to the district, to the national.
Thank you so much, Honorable Beatrice. And we are not doing very well on time. It's a very good debate, but I think that when we started, we lost some time. So we shift to Dr. Betty. Again, in the same study, into district untimely disbursement of funds and low absorption affected service delivery, especially for FP. Occasionally, there were commodity stockouts, lack of youth-friendly services, fewer community outreaches for FP, depressed awareness and sensitization programs for FP largely affecting FP indicators. Despite the investments made in these districts, the indicators were still lacking. So, in your capacity and the institution and the experience, what governance and management practices can be institutionalized to ensure optimal delivery of quality FP services at health units? 2, do you see any role that citizens or FP users can play to advocate for improved service delivery? 3, by revisiting the DCIP mantra, where did we go wrong? Do we need another strategy or operational plan to help government realize DCIP goals? You can summarize, there are quite many, but you can summarize them in a few minutes.
Thank you very much, Jackie. And I think the last one has already been alluded to by Moses, where we went wrong, focusing efforts on budgets instead of accountability and programs. So I'll not take any more time on that. But I'll just focus on what should we do. And I think this is what has helped some of our districts that have been able to achieve and supported their districts to have budget lines on family planning, and they have also been tracking these budgets to see what they deliver. So one of the most important things, and this is not only for the family planning program, but for most of the things that we do, even within our homes, even at the different levels where we serve, is the issue that was already mentioned by both Moses and also Honorable Rachmali, leadership and stewardship. I think the districts need to stand up for family planning as a very important tool for development and give it the limelight that is required to be able to serve the populations within the districts that need the family planning services. Without leadership, even if it is in your home, if there is no person leading, then everything goes astray. So we need to have strong leadership and stewardship in a multi-sectoral manner. Leaving the work of family planning to the district health officer has failed to yield the results that we want to see. So let's broaden this out and ensure that it is taken in a multi-sectoral manner. Then 2, I think there were also major problems with coordination. There are so many different partners, implementing partners, stakeholders that provide family planning. Some are doing training, others are doing mobilizing communities to demand. But these have not been coordinated, because what happens in many cases is that I have money and I want to provide a service at district level. So I will not go through the actual channels to introduce myself to the district, and I start implementing a project. So the leadership within the district does not know what is taking place. So we fall short because we are not coordinated. So it is important to map the different service providers, rather the different stakeholders that are undertaking, even if it is minimal or very small interventions on family planning within the districts, so that we have a coordinated move in promoting family planning at the district level. And we also know that districts are unique, and I'm happy when Dr. Muonge mentioned what we should expect in the next CIP, that we are going to focus on the different regional disparities. And I think that is key because districts have unique challenges with regard to family planning. And I think that will yield, probably by 2025, we shall be seeing the change that we are expecting. Thank you.
Thank you, Dr. Betty. And back to our... Thank you. We've now adopted you, a part of us. Ms. Alice, in view of what has been said by the rest of the panelists, how can media sustain this dialogue, investments, performance, and accountability? Do you see your role at the grassroots, as a grassroots reporter, and I think you already alluded to that, about grassroots reporting, and also recognizing the importance and the role the media can play in improving visibility of family planning? What opportunity do you see that media can leverage on? Which support and from who do media agencies need to play their role optimally? Some of these you already actually talked about them. Just summarize in addition, because I remember you highlighted logistics, reach, and others. Thank you.
I think because I heard the bishop saying that the family planning stories are not given priority. Yeah, this is true, and it depends on the season. Like this political season, it will depend on who makes a statement. That's why, like during this political season, you can encourage these politicians to make statements on family planning, because they will capture the media. They will find space in the media. Let them advocate. Let them make promises. Let them say something. And even the religious leaders and cultural leaders, when they make a statement, obviously someone will pick up that story. So, as civil societies, you can use more of the religious leaders and the cultural leaders to advocate for family planning and funding, because the statements they can make can find space easily. If you do a story on, like, the deputy mufti has said something, you'll even, I've made a story on Capital Radio, you'll find Viola from New Vision calling you. Where did he make the statement from? Can you share the sound? Can I contact him? So that's how we've been working, and this can work more. And the issue of facilitation is really important, especially for those journalists who work in rural areas. They need to be facilitated, because some of them are not even paid, or some are paid 2,000 per story. So they will not go for a family planning story when there is a political story which will run on the radio and that person is paid. That's what I can say.
Thank you. That was really spot on. Alice, thank you very much. We have members of parliament. I think one has stepped out, but the time I introduced them, they were out. For those who are in the room, kindly stand up for recognition. The MPs that joined us when we already started. I think there's a group that was seated there that could be coordinating what is happening during this season. But I think you're very spot on. And we can testify, we've moved with media in all 8 districts. It's not cheap. Just like also moving with MPs. But I remember when we moved with MPs in 8 districts, they made a strong statement during that year because they were able to see the reality in terms of the performance of FP in those districts. So it's an investment, and all of us who work in different areas and we can influence, those people who support us, we need to encourage them to appreciate that they are influencers. They are very key people if we need to move the financing, FP financing agenda. We would like to thank this panel so much. Sometimes, sometimes you sit and you think you've learned something, but again, when people speak, you realize there's a lot more to learn, and we've really learned a lot. And I pray that we are able to replicate this model and change Uganda. Advocacy, we are not working for anyone. It's not about Samasha, Trefe, Chai, Sujui, who, but we want to make sure that Mama Didi achieves her results. So Mama Didi, when we push, you realize your results. So unless there's one burning question from any of the panelists, as the last statement, then we can give them. Is there any one burning comment from any one of us? They exhausted everything. We shall have a discussion at the end because of the time. Just note down. We shall have all the panels come, and then at the end we are going to have a discussion of all these presentations. Allow me to, and join me to really give them a very big hand clap. These are very busy people. These days time is becoming more expensive than money. So when someone gives you a second, but also risk their life because of COVID, do you know we are at risk? And say, oh, but I'll come and be with you. We don't take that for granted. Thank you so much. Thank you. May God bless you. I will call my my boss to again introduce the next session. Thank you.
If you are working with someone, then that person does not become a boss. We are co-workers in the vineyard, and so you are my co-moderator. Members, at this point, we are supposed to have a brief presentation on the study results and findings, but because of time, we cannot have that, and so we'll now move on to the next panel discussion, or what we can call panel discussion number 2, because we've been able to finish panel discussion number 1. And I would like to request those who are attending, both online and here in this room, reserve your questions and comments, because immediately after this second panel discussion, which is going to be short, then we'll have a general discussion. There, people can make comments, can ask questions for clarification, and whatever will be remaining. And so I request that you join me and we welcome the members of the panel discussion number 2. Number 1 is Bishop James Bukomeko of Mityana Diocese Church of Uganda. Please put your hands together and welcome the Bishop. Next is Mr. Emmanuel Agaba, Assistant LC5 Chairperson, Chenjojo District. Please welcome him. And then we also have Reverend Moses Atuhere, Executive Director, Western Uganda Faith-Based Organization Network, is based in Chenjojo. Please welcome Reverend Moses. And then we have Dr. Fred Luasa, DHO Mitiana. Please welcome Dr. Fred Luasa. So we'll go straight to the panelists and ask them or request them to introduce themselves. You mention your name, the organization you represent, and the role you play in that organization or institution. And if possible, share your experience or your journey, if you can, about this model we are trying to disseminate or learn. So let's begin with you, Bishop James Bukomeko. If you have a microphone, please. You take this one.
Thank you very much, all of you who are listening to me. I'm Bishop James Bukomeko from Mitiana Diocese. And I'm a champion of good families. So I have a divine role of ensuring that the mission of Jesus, recorded in John chapter 10, verse 10, life in abundance, is promoted. The best way to advance this mission is by promoting good health care and also ensuring that all key stakeholders are accountable to both funds made for health and services at large. Thank you very much.
Next.
Thank you very much. Once again, I'm Agaba Emmanuel, the District Vice Chairperson for Chenjojo, and I'm here on behalf of Chenjojo District Local Government. As a person and as a district, our serious engagement towards this noble cause can say started in 2017, because that's when born in conjunction with the FHI brought us on board, and we were able to start, of course, making some allocations which was very small, and the biggest point, we had not understood the importance of integrating, of disseminating family planning services, because it was from 8 million and up to 159 million as of last financial year. But it is a journey to walk, not as an individual, but as stakeholders, after understanding that leading a well-planned population is easier than a poorly planned population. Thank you.
Thank you. Next.
Thank you very much. Dear participants, I'm called Moses Satwaire. I'm working as Executive Director for Western Uganda Faith-Based Organizations Network. We started this journey sometimes back since 2000. 17, as Chairman said, on family planning. But we have walked a long journey with the mentorship of Jackie Katana since 2016, when she happened to mentor the formation of this interfaith network with support from PAI. I want also to recognize Reverend Moses Semgoma for pioneering this process together with us. In fact, we were 6 partners all over the country, and it's Mitiana which developed the first DCIP, then Chenjojo became the second district to develop the DCIP. So we have been interdepending on each other, learning from each other, what they are doing, what are the challenges, and how can we mitigate those gaps that we have identified. Above it all, I am a champion for women and girls.
Thank you. Next.
Thank you, my Bishop. I'm Dr. Wasampija, the District Health Officer, Mitiana District Local Government. And as my responsibility, I head health services in the district, but I've worked closely with the Church of Uganda, and especially Mitiana Diocese, Action for Health, Face for Family Health, and others, especially for development of the district CIP. And we are very grateful for that collaboration, and which has brought us very far to this level, ensuring that family planning services are provided in the district. On top of that, as head of the service in the district, I'm mandated or bound to participate or to ensure planning and budgeting is done, and allocation of resources is done according to the program areas. And the family planning is one of the priority areas as a district, as a nation, to where we allocate resources and where we ensure that services are provided accordingly. And we supervise to ensure that these services are provided, and we also coordinate the various partners. We have many partners we work with to implement family planning services in Mitiana. So we coordinate all of them, bring them on board, and ensure that each one of them accounts for his stay in the district. And we also ensure that the policies are implemented, standards are implemented, because we have standards which we follow, to ensure that everybody is at par with the standards, and they are observing it and they are following issues accordingly. And we also ensure that human resource is prepared, human resource for health, they have the capacity, they have the knowledge to address issues of family planning of the client. Each client has individual issues and the challenges, and our health team must be ready to address these issues of a commodity, ensure that commodities are available, essential medicines, we plan and procure, and ensure that these ones are available. We also ensure that we account for these things. Accountability is so important. Account for these commodities, account for the money we get, and account for everything which comes to the district. And lastly, we normally organize review meetings. We need to review how we are performing and how we are moving on with family planning. So all those are the activities as a department which I coordinate and ensure that they implemented in my deputy.
Thank you very much, our panelists.
As implementers, actually this is a panel of implementers, the people who cooked the food. I would request again that they come and present the policy issues and recommendations that came out. And I will start by calling Reverend Moses Semgoma to come and present what were those key issues that came out from Mitiana. And then I'll pull out again Reverend Moses from the panel. You come and also present, because whatever they are going to be discussing is informed by some of the findings of that study. Thank you.
CIC's district interface committees. The policy issue was that this CIP is not embedded into law or at the district in the district plans, and it is therefore not informing the FP allocations. And there, our policy recommendation was that this CIP our next policy issue was that the district does not have a clear FP budget line. Then also family planning allocations are not protected, as Jackie already mentioned, and therefore can easily be used when instances they drop even when there is an increase in allocation to health sector. Then also another policy issue was the disbursement of the health budget funds from the central government and other revenue sources to the district is not timely, and in most cases it is not 100%, as Dr. Mwonge already and Dr. Bet already also emphasized this. Another policy issue was that it is not also clear what percentage of health program budget is spent on family planning services. Then lastly, as a policy issue, there are delayed and reduced disbursement of funds to health facilities, leading to stockouts. Moses.
I'm proposing, since you're already comfortable there and there are many cooks in the house, Sheikh, you could come and present the policy findings of Chenjojo.
Ladies and gentlemen, it's a pleasure to stand in front of you and to share with you the policy gaps and recommendation from Chenjojo district. Yes, yeah. By the names of Sheikh Keza Abdul Ali. In the policy issue, the district cost implementation plan, as we had earlier told you, is not informing planning and budgeting of family planning in the district. But there was a policy recommendation that the district cost implementation plan should inform the district investment plan for family planning, also conduct a mid-term review to assess the progress of the implementation of the district cost implementation plan. Another issue of policy was the district has no dedicated budget line for family planning. However, the policy recommended was the district should have a dedicated budget line for family planning. There is also an over-reliance on donor funds for family planning as a policy issue. However, we recommended the district to increase its domestic investment on the family planning issues. Another policy issue was the disbursement of the health budget from the central government to the district. Sometimes is not timely. The disbursement is never 100%. Therefore, as a policy recommendation, we recommended that the district to engage with the central government to ensure prompt, timely, and full disbursement of the health budget. Another policy issue was delay and reduced disbursement of funds to health facilities for family planning. However, we recommended a policy that the district should ensure a prompt, timely, and full disbursement of the health family planning funds to the healthy facilities. Lastly, there was a policy issue on low absorption of the health family planning funds at the facility level. Therefore, a recommendation was made that healthy facilities to develop a robust mechanism for monitoring utilization and accountability of the health family planning funds. Thank you very much.
To give us a snapshot, in interest of time, if there are any other issues that came out, then we might have to summarize them. Allow me to recognize our participants who are online. Because we had technical issues, some have signed out. We had FP 2020 Secretariat at the beginning. We had PAI represented by Chelsea, but I think now also the time. We have Angela from Action for Health. Bansi Wanjiru is the consultant behind this. Benon Musasizi, Bridget Natkunda, Charity Nageni, and Stella Kentu, CSRHR Alliance Chairperson. And then we have James Nyaga, is our programs director, but who is based in Kenya, Nairobi. We will continue to recognize them. Thank you so much for being patient. We had IT challenges, but at least you're able to keep on. Now we will go on to the discussions of our panelists, and we shall delve into the real issues because most of this has been discussed. The panel is already introduced, and I will not even go into the background because the background are those findings. So we'll start with Reverend Moses Atwere. Tell us about the story of advocacy, but mainly focusing.
Dear fellow participants, I'm very happy to share with you about the accountability model and how we have been working in Chenjojo district. First and not foremost, here we are together with the entire district DIC representative. I can see Sheikh, I can see Sister Jacinta, Serif. Those ones we have worked together since this journey started. Over time, there has been development of policies. We have developed policies. There are several policies, and Uganda is recognized as the #1 country at developing policies. But we have been asking ourselves a question: how do we move forward? What is next after developing a DCIP? What is next after having these youth-friendly corners established in health facilities? What is next for this and this? And despite having all these policies in place, robust mechanisms in place, but the indicators for family planning are not changing. Instead, they are increasing. So we decided to venture into accountability model, working extra mile to find out the money invested, resources invested in family planning are put in better use. But not only looking at resources invested in, also finding out the tangible demand created by these resources, vice versa the supplies in health facilities. So we had almost 8 key processes we had to undertake at a subnational level. First and not foremost was mobilization or mapping. We did mapping of key stakeholders who would help us or identifying key decision makers who would help us move further with this advocacy for accountability in our district. After mapping them, together with the district interface champions, we went to them, and with support from 3FHI, we got a training. These faith leaders were trained in advancing family planning approach, smart approach. They are able to set their own quick wins at institutional level, at the faith institutional level, and also collectively as a district interfaith. Then also setting these quick wins as a district family planning technical working group, so that we are able to track what we have committed to do, and in a short time have we been able to achieve these results, and that is how we started. After getting trained in all these, we also found need to get trained in tracking, budget tracking, and we could not do budget tracking minus knowing the budgeting process. So these faith leaders were exposed to budget process, the budget cycle, and implement budget planning and the implementation cycles, so that you are able to know when the year begins to plan, if I'm to advocate for an increased resource, and when do the implementation stops, if I'm to track the progress made. So the faith leaders were trained in that. Then after training these champions, they went and formed what we call micro alliances. They built their alliances. They found their own ally. So and so will help me achieve this. Maybe it's in multi-sectoral. Maybe it's owns the data at the district. This is a politician. So those allies we formed, they helped us reach our goal. Then from that, we started making, we divided ourselves into different constituencies. Like St. George is divided into different constituencies, and we have few government health facilities. Attach these champions to government facilities so that they can form what we call, or conduct what we call micro-consultative meetings. So they went deep to do micro-consultative meetings with the health facilities, bringing the VHT as a representative of the community, bringing a religious leader, bringing the family planning focal person at the health facility, the in-charge, the like. Then we discuss family planning. The work plan is available to us because they already know exactly what we are after. We are after improving service delivery of that particular facility and the entire district to inform our report and the like. So we could get the information direct from those facilities, interrogate the data, and own it. You know, like the problem with much of research done in Africa is coming on the ground, you collect the data, then after 2 years you bring a report. This data was collected in 2018, you're bringing it in 2020. People, they will disown that data. But immediately after collecting this data, we come and present it to the policymakers. As we move, we go ahead to do infographics. We already have data playing with it from different sources locally. Then after building these alliances, micro-consultative meeting being done, then we had a tool to collect this data, and these tools helped us to collect information direct from the facility health services. Back to this, as per the district commitment had committed to allocate 2% to family planning per each health facility. And during the assessment, the allocation surpassed the commitment. In Chienjojo, due to these interventions, they allocated much. They allocated over 5%, 5%. And then we went ahead to look onto now allocation, disbursement, absorption. And we interrogated all that
so that we can come out with these policy recommendations and the gaps that have been already read to you. And that was followed by the advocacy and accountability engagement at different levels with the district council, with the Parliament Committee on Health, with the religious leaders, and the entire family planning technical working group of the district that meets quarterly.
Thank you very much, Reverend. Some of those commitments that were secured and how you supported the government of Mityana to plan and realize them. Thank you very much, my Lord Bishop.
Thank you very much. Before securing commitments at our district level, we had to do a study to know better how Mityana district is doing in the 4 major areas of accountability, and that is allocation of funds for family planning services, disbursement plans and time schedule, expenditure of the funds, absorption capacity at all levels, both at district, sub-county and health facility level. These studies were made, as you said before, I was a bishop, but after becoming the bishop, it was in March this year, I was lucky to attend these meetings. And when I participated in these meetings, I was able to learn so many things. All these meetings brought together key influencers across the district. As a key outcome of these meetings, policy commitments were secured. And I want to thank my brother, Reverend Moses, for the great work he has done in the diocese as the health minister, and also for guiding me as a new person in this area. Thank you very, very much.
Thank you, my Lord Bishop, and Wendy was online, but I think she got busy. She knows very well that that's where the journey started and it spread. So it's a mustard seed that has now spread to other districts, and here we are. Honorable Agama, the only person representing the executive in this room, you recall very well that when we were in Chenjojo, together with the DHO, Assistant DHO, Dr. Nita, members of the District Council and yourself participated in the participatory budget analysis. In the 3-day exercise, the government officials joined with the religious leaders, elected leaders, youth, women, combed through government budgets, district annual plans, healthy work plans, and performance reports. In your view, was this helpful? That's one. 2, how did you, the Council and Department of Health, take it? How did you take the whole exercise of coming and we are combing through all your documents? 3, doing the analysis, and which you and your team participated in, you realize there were a number of barriers affecting FP investments and performance. As an elected leader, has this changed your mindset in regard to FP family planning and budgeting in order to improve FP investment? What governance, management, service delivery, and policy decisions changes are we likely to see in the near future in Chenjojo and beyond? Thank you, Honorable.
Thank you so much, Jackie. Protocol observed once again. During, of course, COVID time, this is the time when we are, sometimes we call it being attacked or being invaded. You know, see, as you earlier said, Madam Jackie, that some districts, when you go there, they think you come from the IGG office. But for us, being in a COVID period, we remained on track. And I believe when you came, you got the information. To us as a district, it was very helpful because it checked our strengths and weaknesses. We were able to identify our gaps, which of course we shared in the three-day workshop at Tropical Gardens in Chenjojo. And of course, as a district, this didn't take us bad, it took us very well, because in that exercise, we were able to to institute a stronger, I want to use the word stronger, an active family planning technical working team, of course, where we have ourselves as council, as the highest planning authority. We have the CSOs, where we have the FBOs, where we have the excuse me, where we have the district health team, and in that period, we were able also to check on the performance of family planning services. On this point, I want to be put on record that I want to thank the central government, because we were worried during COVID time that our performance will drastically go low. But the requests that we placed as far as for family planning commodities was concerned were honored in time. And that was really very, very, very recommendable, because we were worried of the season. Of course, we had very little challenges, because 37% of the family planning budget is funded locally, and the local revenue was not coming forth, but we were able to integrate the family planning services within other services, despite there was a lockdown where we didn't have outreaches. But the mothers were always cleared, because we advocated that the COVID task force was able to respect the mothers going for health services, and family planning services was also highlighted. As we maybe to remind to tell you, Chenjo district, we stand at 41% as far as modern family planning services is concerned. So I think we are doing fairly well compared to the national level, though we have not yet achieved our national target of 50%, but at least as a district, we are at 41%. Madam Jackie, of course, during that time, the faith community partnered with us when I say us, it means the district to carry out a case study on actions, or on the 4 actions. Hope we all know the 4 actions. That is the allocation, disbursement, expenditure, and accountability. And our, of course, the four actions and commitment were, of course, shared among the stakeholders. Gaps were identified with the stakeholders, and we had to renew our commitments as a district during that period. An action plan was adopted, or prioritizing the policy actions and recommendations, of course anchoring the planning and budgeting process as we reviewed our mid-term and end term, because we need to keep on checking ourselves and we see our progress. Probably as I conclude, in the near future, we want to advocate and integrate the family planning services. We also want to strongly come out clearly on the early marriages, teenage pregnancies, and make the services accessible, available, and be able to be used. The young generation, as we have been discussing in our previous meetings, seem to be left out, but because we're putting on their specific youth-friendly services, we came out to understand what should we do as a district. That's why we want to strongly come out for the early marriages and teenage pregnancies. Of course, we have to do this in tandem with the DCIP, because the DCIP is a guiding tool to see how we can be able to move on. And I may say, Madam Jackie, that family planning output is worth investment if we can go by our commitments as policymakers and stakeholders. Thank you.
Thank you very much, Dr. Fred Ransa Pija. You've worked closely with religious leaders. Actually, it's not recent, even before 3FHI officially continued since 2016, again under the same partner. We've walked this journey with you, and you've developed, operationalized, and ensured that all policy issues are identified during accountability assessments and they were acted on. Was this helpful? That's question number one. Two, what are the district agenda? What is the district agenda to ensure that the policy action plan is fully developed? And remember, we have a roadmap. Those are some of the key actions. We have the DCIP. I know we are implementing, but you can see the study is saying that we are not fully implementing it. So building on what is happening in Chenjojo, how was this helpful, and how can we make sure that these action plans are fully developed and executed? Thank you, Doctor.
Thank you very much, Madam Jackie. The first question was this exercise helpful? A big yes. The exercise was helpful because it opened our eyes to see the gaps which were existing in our service delivery. Gaps in areas of financing our CIP, gaps in areas of disbursement and expenditure. Expenditure, because you may budget and you don't expend, spend money on the very activity you are planning to do. So really, it helped us to open our eyes to see that we need to do something, not only to advocate and have this money there, but should be put there and actually used and implemented accordingly. So the exercise was very helpful because it was a form of accountability on our side, and it was for service improvement across the board for family planning services. And it also helped us to track the resources we are putting there to give a picture of what is happening. Are we releasing money in time? Are we releasing money according to the budget? And so on. Really, I could say that the exercise was important, and it helped us to open our eyes and have a wider perspective on family planning issues, services, and allocation of resources accordingly. And when it comes to the agenda of addressing the policy, identified policy action plan, actually, as you know, already Dr. Chadon related on it, that we are in National Development Plan 3, and as a district, we are also doing our District Development Plan 3. So in that process, we are adopting and adapting some of the issues in the National Development Plan, so that we have a harmonized plan. Because now we are looking at program planning. Program planning as used to base our planning on output-based planning, but now we are looking at programs, budgeting for programs, and planning for these programs. And as already hinted on it, Dr. hinted on it, we are on human capital development issues, and family planning is a very big component there. Human capital development. Because under this human capital development, we have health there, we have community there, and we have education. And all these departments have issues to do to support family planning issues, sexual reproductive health, and others. And as we plan, so that we bring in the issue of budget line, so that family planning is allocated money. We have areas in this human capital development programming where we have sexual reproductive health as an area for allocating money. Family planning is another area to allocate what? Resources. Adolescent and youth services is another area we are going to allocate what? Money. In this new development plan we are developing, which should look similar to the National Development Plan, which is already. So we hope by doing so, the budget line for family planning is going to be realized, and we are going to allocate resources. The issue of fencing, shall discuss that one in district council to fence this one, so that money is allocated and effectively used for that service moving forward. And we are also planning to make end review of our district CIP. When we do the end review, we are going to roll it forward, because the time has expired. We will need to develop a new one. At the national level they're doing, we're also going to be doing it at the district level to review our CIP which has been going on, and then to roll it going forward to ensure that we continue implementing this program. Because family planning is a program, and we must ensure that we continue programming it and doing some work on it. On the issue of releasing funds, release of funds we have two types of funds for the department, I could say. We have PHC funds. PHC funds, this one comes in time, and we take trouble to release this time money in time to the facilities. But the another source of funding is the resource-based financing. This money comes directly from Bank of Uganda to the facilities. This is the money which normally delays. And the drop this money sometimes is by our facilities not reporting in time and compiling their reports in time. And this money resource-based financing is also, there's a very big component on family planning there. Because family planning is one of the area which attracts resources. Because resource-based financing is attracting resources. And within RBF, there is a component strictly to do with long-term family planning, for example, and short-term family allocated money. So if you do well in those areas, you are likely to attract a lot of resources to the district and to the facility. And under this RBF, we are also seeing some progress towards family planning. And also, we have committed ourselves to coordinate partners we work with. I have many partners in Mtiana, ranging from faith-based organizations. We have others, Milestones, Action, Chai, Face for Family Health, RHU, Maudmei. All those ones are making a contribution, each one, and we coordinate, and we make sure that we coordinate them so that they also do something. And even private service providers, there are those ones, like the pharmacies, the drug shops, the clinics. All those we are endeavoring to bring them on board and track what they are actually doing to make a contribution toward these policy issues we have identified, to ensure that family planning as a program, it is sustained and given its due status in our district implementation plan and services.
We are coming to the end. I'll conclude by saying acting on policy commitments for FP is an essential step in securing change and transformation. And that is very, very important. I'll not repeat all the panelists alluded to that. Our online participants, we are going in for the discussion, Q&A, together with our physical participants here. And these questions are from the time we started, because we realized if we had to break, it was going to be very difficult. Hopefully you jotted down your questions, direct it to the person you would like to answer, and let us be brief and precise. And then let's also have new questions, not again repeating what is already said. Friends, join me to appreciate our cooks, the people who did the cooking of the model that we are discussing today. Thank you very much, our panelists, and you've given us really concrete experiences. We'll go back to the audience, but if there's any question directed to you, you answer it from where you're seated. So we are coming to the final, second last. But I don't know what to give. He's talking about logistics. There is still behind. There are people who came late when we are done with lunch. If you feel really it's getting out of hand, you go slowly, pick a cup of tea, so that when we get out, curfew is not another issue. And then we have a few minutes, which I'm going to invite my Lord Bishop to tell us how many minutes and how many questions. Thank you very much. And we truly, truly appreciate. This has been a very learning. It's unfortunate that technology knocked off many people at the beginning, but it has been a very good experience.
I appreciate my co-moderator, but I also appreciate the panelists and the work they've done in giving out the information. Information is important. Unless you give out the right information, then you create rumors, people talking about what they have found only because they don't know what to talk about. But if people have the right information, then they talk about what is right in the community, and then people are able to handle the matters or issues the way they are supposed to be handled. So what Faith for Family Action for Health has done is very important, because they have passed on information to all of us. Now, let's go ahead. We are supposed to have finished by now, because after the discussion, we are supposed to have the discussion for a short time. We had planned for 30 minutes, but we cannot now go for all 30 minutes, because in any case, some members who should have asked many questions have already signed out, and others have already left the room. Even some of us who are like, hey, is the curfew is going to find me in Kampala, or we will have left, because you know the jam outside there. And so I request that by the show of hands, let me see how many have questions to make, or give, or ask. 1, 2, 3, 4. Now, I will request those 4 questions to be asked, and then after they have been asked, depending on who are supposed to respond, whether panel discussion number 1 or panel discussion number 2 to go ahead and respond quickly, and then we get the closing remarks, and then we also get a closing prayer, and we end our meeting. And so, someone with the microphone, if you can begin from there, then you move towards this direction. We begin from my right, we come to my left.
In group 1 and group 2.
Okay.
My question, I think I'd like to request Dr. Moore to respond to it.
And is he still around? Okay. Now you direct it to the panel.
Okay.
And they will respond. Because the representatives are here, either 1 or 2, whoever has the capacity to handle the question, will. Okay, go ahead.
We have discussed in detail the investments in family planning, accountability of the investments, accountability, and then we've also seen the 3 cases of translating accountability actions into, accountability commitments into actions. But there is one thing that I have not seen. All this information is not gender disaggregated. And I would like to find out from the panelists, do we have any efforts, any plans to ensure that we promote the utilization of male-related family planning methods? Thank you.
Thank you so much, FHI, for organizing such a meeting and for all the faith leaders that support this advocacy. 2 questions. Number 1 is from Dr. Muonge, but also Betty Chadondo kept talking about the multi-sectoral, the need to engage in a multi-sectoral way around this family planning advocacy. But I didn't hear anybody explain how that can actually happen, and that's what I wanted to hear, because we've been engaging at the districts, we've been engaging at the national level, and we are saying it has been siloed. So if you go into a district, what is that idea that you bring that, as in how do we practicalize that to ensure, maybe Ministry of Education is on board, or all the relevant stakeholders are on board? How do we want to make that, how does that look like? My second question is specifically to Dr. Rwasampija, the DHO Mitiana. The discussion around RBF, because facilities are getting a lot of resources. Some of them are getting up to 5 times more they get in RBF compared to PHC. But the performance improvement plans that are developed before facilities are accredited for RBF are not shared openly. So sometimes it becomes difficult to actually support or work with facilities and the districts in terms of accountability around these resources. So all these monies that are coming back to the facilities, how are we ensuring that they plow back in terms of improving family planning services, or buying commodities because they are given some for that, or even motivating staff that are providing services related family planning at facility level? How do we support that if this information is not available? Or also maybe just to share from your district, if you are doing that already, then it would be good for us to hear and learn so that it can be replicated maybe in other districts. Thank you.
Okay, thank you. The second question was directed.
I'm Sister Jacinta from Kienjojo. I'm very grateful to this 3 FHI for having brought this on the board and also making the religious realize their effort or what they do. Mine is not a question as such, but observation. We still have a knowledge gap on the side of adolescents, the youth, and the elderly.
as concerning family planning. All along we saw that family planning was maybe misunderstood or not understood at all, or some people still think it is a Western way. So we needed to bring on board, maybe through FHI, the adolescents, the youth and elderly, so that they understand this concept, or else it will still hanging as we are seeing. And I was proposing that let family planning be integrated in each and every activity. As we have said, it has always been perceived as for health. And even the health people, most of the time when me and my health work, whenever we are for meetings, when you reach a point of family planning, you say, for family planning you hold on. And at the end of the day, nothing will be tackled. Then you will say, but we thought of family planning next time. Then it ends there. It's high time that family planning, I'm requesting the member of parliament who are present here, is it possible whenever you sit, we understand you have many meetings, could you make it a point whenever you sit, each one from her constituency or his constituency gives something about family planning? It's high time we wake up and do something, not just a me of talking. Thank you.
Okay, it started as an observation and since I didn't introduce myself because I joined when you had introduced yourselves, my name is Patrick Mujigwa and I work as a program manager with Partners in Population Development, Africa Regional Office. Thank you, HI, for inviting me to this meeting and enabling me to meet once again my Bishop, James Bukomek. You were my church leader at St. Stephen Church in Nansana, and the leadership with the range of development that you left there is still a memory to most of us, and it will take many years to get stale. You posed the question, Jackie, that should we shift from investments to performance? And I was very willing to get a response to myself whether we really have investments to talk about before we start talking of shifting to performance. Yes, I know that some modest investments have been made, and anybody would be interested in tracking those small investments, however they are, to see what performance out there that has resulted as such. But still, for me, I think we shouldn't be talking of shifting, because clearly when you look at the CIP, FP that is phasing out, the country has never matched the funding requirement for family planning. For 2019, for instance, the funding requirement was $47 million US, and only a modest, around $2.6 million was allocated. For 2020, funding requirement was around 47. Again, the same amount of money, around $2.6 million was allocated. So for me, we should not start talking about shifting from investment, but we should continue advocating for having more and more investments, definitely as we look ahead to seeing how these modest investments have been, what performance has resulted as such. My second point is about accountability. And we've been talking about accountability. But I think we should now change the language to just talking about accountability, talking about mutual accountability. In the sense that if I give, I should expect you to take. We have done a lot, as PPDR, for instance, with other stakeholders. We have done a lot to do advocacy, to making sure that some modest allocations are made for family planning. And some achievements are there for everyone to see. But we've been talking about tracking in the sense of having allocations, having releases, disbursements, expenditures, and for good reasons, and all of that. But for us, I get amazed when we work in 15 districts countrywide, and every time we do a landscape assessment, and we ask why the communities out there are not using family planning services and information. Number one on the top list is always religious and cultural influences. So to me then, I ask myself, as the faith-based, are we doing our part in terms of accountability, giving back to what has been given? Have we sensitized these masses to making sure that they do partake family planning services and information? I'm not directing it to anyone in particular. My Lord Bishop, we will get, and I think also in a position to give us a response in that regard. Thank you.
Thank you, my Lord Bishop. My name is Mugeni Mili. I'm the woman member of Parliament of Butaleja District, a district with the youngest grandmother in the world, and I'm also the patron of Mothers Union in that district. I want to appreciate all of you for all the comments that you've made, and the presentations were so enriched, and I've also learned a lot from this session. To begin with, like some members have said, this is a multi-sectoral problem. It touches everybody. Much as we may pretend and say it is leaders who should say ABC, this, everybody must talk about family planning. And I've always been challenged, especially when it comes to religious leaders. But it is quite good that the bishops are here, the Muslim clerics are here. As members of Parliament, for me, I've seen it and I've experienced it. At one time, I was at a function, at a wedding, and I said, since I've seen so many young girls here, and we are challenged with the issue of teenage pregnancies, let me talk about family planning. And just guess what happened later. I was brushed off. I said, you know, when these young girls go to Parliament, they get spoiled. How do you dare? Moreover, being brushed by a reverend, you see? So I'm wondering, has this faith for family health gone down to the grassroots to talk about this issue amongst the church leaders? Perhaps it is in our boardrooms in Kampala, and some of those people don't know what to say. They don't know what to do. There are some people who still don't believe in family planning. They are there, and you, as a politician, you know, for us there are things that we don't talk anyhow. You look at what others are saying and you say, how dare do I talk about this? Much as you know that it is true, it will help your population. So let us really make sure that we take this engagement to the grassroots. Because for us, we're already empowered, we know what to do, we know what to say, and you know how to apply it. And we also have a very serious issue, that is an issue of stigma, especially for the men. Because I've not seen men coming out to talk about family planning for husbands, especially vasectomy. They fear. There is no bold man who can come out in the community and say, you know what, for me this is what I did to myself. Actually, you've not even been invited to meetings of men. I said, that one has become a woman, you see? So how are we dealing with this? This is a threat to people's families, much as we think that it will benefit us. We also have a problem of population growth. At one time we had a meeting as members of Parliament with some CSOs, and we said population growth is affecting every department and agency. And somebody says, no, population is not a problem to Uganda. I don't know whether some people come from heaven or what, but some of us who come from districts where producing children is a serious issue, we know what it means when we talk about population growth. So I think the CSOs should have proper coordination, because I see a duplication of services amongst them. I don't know, I don't see why we don't have regionalizing of these, you know, efforts, so that we don't scatter the monies, we don't scatter the efforts, so that when we are concentrating on Eastern region, where you know very well that the highest levels of poverty are in that region, why don't we say in these 5 years we are going to concentrate in Eastern or Bukedi sub-region, so that we see the impact. But when we scatter and say, we are in Bundubujo, this one is in Ntoroko, this, we shall not see any impact. Perhaps those are the comments I had. And maybe on the recommendations, yes, I saw some recommendation where there is over-dependency on foreign funding. Why don't we make a strong recommendation and say departments and agencies should prioritize funding for family planning. That is just my suggestion. Thank you so much.
Thank you very much. We really appreciate your comments. You will realize that we are not at the same level of understanding. People who are not in this room, even if they are bishops or clergy, may not necessarily know what to communicate to the public. And even those who believe in family planning and others don't, it's because of their lack of knowledge, it's lack of, the lack of information. And so just understand that we're not at the same level. Bishop Bukomeko is talking, when he's talking about family planning, you think he's an expert, but not many bishops who can speak like him. And so there is a need to continue doing what we are doing today. We are calling it disseminating and learning. And so let's quickly and briefly, and then we end our meeting. Okay, let's begin with the bishop.
Honorable Mire and my brother about family planning versus religious leaders. The meetings I've attended, this has been an issue. And many religious leaders were giving testimonies when they first joined this campaign. Some of them didn't know that this was right to do. But later, they realized that it was the right way to go, and now they are advocating for family planning. In my church, we have engaged clergy. We teach them about family planning, and also we teach them and send them to go out to talk about it, because this is a serious issue in our community. About accountability, I think we need to work hard to see that religious leaders join this big campaign on family planning, and also support this great move to advocate for whatever we have discussed at all levels. Then we shall come up with accountability when we see even tangible fruits. That is what I'd want to say. Others can add on.
Thank you very much, Bishop. We will have only 2 people to respond.
To happen, and I think in our submission during the panel, we talked about the NDP3, the Third National Development Plan, which has moved from output-based budgeting to program-based budgeting, and programs are featuring in a way that they are looking at the result. So for family planning, the major result is ensuring that we see fertility reducing. And this is captured in the Human Capital Development Program. And as also Dr. Rasampija has pointed out, the Human Capital Development Program does not belong to health or to the Ministry of Health. There are so many players that are ensuring that we achieve the Human Capital Development Program in a multi-sectoral collaborative manner. So that is one. But I also want to point to the issue of what has been happening at the districts, where we have been in the process of developing the costed implementation plans. Family planning working groups or advocacy groups, whatever names they have been given, are already multi-sectoral, because they bring a wide range of players. And when you develop the costed implementation plan, the docket for its implementation, the person overseeing it is not the DHO. In most of our districts, I think it has been the chief administrative officer because it is multi-sectoral. And this also helps in tracking, in coordinating, but also in ensuring that other departments, other districts support the family planning program. Thank you.
You appreciate it, Dr. Rwasa.
Performance improvement plan under RBF. RBF, as I said, RBF is a fund, an additional fund to what other funds are being getting from government. This fund is for maternal, reproductive health, and family planning and child health. So somebody was asking that the PIP is developed by the facilities, and how do they support these facilities to ensure that there's accountability and the contribution to improve the family planning services. Maybe the entry point to this PIP development at the district or in the district is the DHO's office and the focal person for RBF. So that those people who are interested to contribute, they should participate in the performance planning with the in-charges or focal persons of RBF from the facilities to ensure that these resources are allocated for family planning. But actually, even as I said, resource-based financing, this is the money which you pull. They don't allocate you money. It is your performance which determines how much you get. And the family planning is one of the core area which attracts money to these facilities. There is money for short-term family planning, and there is also money for long-term family planning. Whichever lady or mother you get for long-term family planning, it is allocated around 20,000 shillings. 20,000. Then short is about 1,200. So really, if you mobilize and ensure that the more mothers you get and you give a service, the more money you are going to attract. That's how disaster-based financing works. So whoever wants to participate in the planning at the district level with the in-charges and the focal persons of RBF from the facility. It's a very good fund because the sky is the limit. If you work, the other components actually, deliveries you conduct, cesarean section you have done, children you have seen in OPD, seen by a clinician, all those parameters are considered and then you are rewarded accordingly. And then there are even those quality scores. Do you have a management committee in place? How often does it sit? What do they discuss? Those issues are some of the issues we look at in RBF.
Thank you very much. We appreciate those remarks or responses to the issues which were raised. Now, let's go ahead and have the Member of Parliament, Honorable Vickers.
My Lord Bishop, thank you, sister, for that observation. Yes, members of Parliament, as representatives of the people, can influence the communities to use family planning. But as we have already heard, this is a cross-cutting issue. And as Mr. Patrick Mujera has said, for me, I think we should use a mix of approaches to achieve increased use of family planning. I think we should focus on community-led approaches because the people we are trying to advocate for live in rural areas, live in the communities. So in order to increase uptake of family planning, much as the politicians are talking, the health workers are talking, religious people, we need champions at community level. We need to engage opinion leaders at community level. We have mentioned cultural leaders, religious leaders, but there are other people whom we regard as opinion leaders in every community. So we need to target them to ensure that they are on board so that they are able to convince the communities to take family planning, to overcome the myths and misconceptions at that level. Thank you, my Lord Bishop.
Thank you very much for your response. Put in the chat box by the members who attended online.
Thank you very much, our online participants. I'll start with Angela. Action for Health, and it says important harmonize the study results. Yes. For example, for Mitiana, the study was informed by Action for Health study, which was already done. So it was more of a desk review, and if you look at those findings closely, they don't contradict what was already indicated. Benon Msasizi, we need to invest more in health economics, evidence generation to guide investment, yes, and that's why you see today we are talking about the findings, and none of these district leaders could deny that what we said was an allegation, because that was evidence. But as you said, we still have very few people, and we have to import consultants left and right, so we need more health economics. Allow me to mention two more. One is shifting by Patrick. What we meant for over years, and you bear witness, we've done a lot of budget advocacy, increase. So now we are saying, can we all now continue, as you said, balance model? As they increase, then they make sure that performance happens. But we've been talking about increase, but we are not following to see what they've increased, what they've allocated, whether it has improved performance. And that's a kind of shift we are talking about. We are not abandoning the first phase and going to another phase. I'm not a religious leader, and they talked about it. Religious leaders, all the religious leaders who are in this room can bear witness that this has been a drop in the ocean. But where we've worked, even when we are in a boardroom, the same religious leaders, like the ones you see here who are coming from Toroko, Chenjojo, Mitiana, when they are even giving their sermons, their messages are different. But it's a drop in the ocean. Of course, there are other FBOs, but in terms of family planning, we've only reached 88 districts. So you can imagine if we had more districts or other FBOs expanding, we would be able to change the mindset. And why? We start with the leaders. That was strategic, because you know how it works. When the leader says, then the rest. So we started with the leader, we started in the boardroom, and then the rest will be done even without a lot of facilitation. Thank you so much. We are really grateful, and I hand back to you.
Thank you very much. We appreciate those comments which have been made by those who attended online. I would like to right now call upon Sister Jacinta to come on behalf of the board members to give the closing remarks. I want to appreciate everyone's patience. The meeting in the afternoon is not easy, but we've pushed, and also a lot of information had to come out, but you have endured, and I thank you all. So let's have Sister give the closing remarks, and then we can end our meeting. She's going to give closing remarks, but also say closing prayer. Okay.
I'm happy to be here afternoon to say a word to you. These are my remarks. Jesus put us on this earth that we may be able to enjoy it. That is found in John chapter 10, verse 10, that we enjoy it to the full. But when we are not planning properly, especially for our families, you find we are halfway. It is always very sad if you find someone have 10 children, some are having jiggers, some are not at school, some they are not naked. So those people, they are not enjoying this life of which Jesus meant for us. That's why it is high time each one understands family planning, starts planning for the family, which he can manage, so to be able to enjoy it economically, spiritually, and physically. I thank each and everyone who have dedicated the time this afternoon I know it's not an easy time, but at least you have tried to spare this time for this noble cause. May God bless each and everyone and bless your effort and your time. Can we have a word of prayer?
May we all stand, please.
Lord Jesus, we thank you for Jackie's effort, for the organization that is the 3FHI, which is bringing us together for this noble cause. Lord Jesus, we pray for the donors. We pray for an individual, whoever feels that it is important, either to participate or give a hand so that this organization continues, so that in the future we may have a healthy and well-being of an individual. We ask all this through Christ our Lord.
Amen. Amen. Thank you all, and God bless you as you travel back. We appreciate everyone's participation and everyone's contribution to the ideas and everything that has been done. We appreciate the technical people, the IT gurus who have been able to include those who have attended online. Thank you for your expertise. Please continue to work hard and give support to different meetings, because we call this a new normal or the business unusual. Thank you very much and God bless you. My name is Amos Magezi, the Bishop of the Diocese of Northwestern Corridor. God bless you.